So for this video, I'm going to show you how to do sub-Q fluids for your dog or cat or any mammal that you have. Subcutaneous fluids are good for if your dog has diarrhea or vomiting and is severely dehydrated from that. So basically what you're going to do is you're going to get a bag of fluids from your vet. If they allow you to do it at home, you can do it at home and save a lot of money. And it's really easy to do, and I'll show you how to do that on my dog today. So basically you're going to take home this bag of fluids. You're going to get a full one from the vet, and your vet should tell you how much to give your dog or cat every so often to get them rehydrated when they're sick. So for Max, I've already used a little bit before, so we're going to give him some more today because he's been sick lately. So you're going to go home with this bag, and then they're going to give you the line that goes with it, and it's pretty long, so it can reach pretty far if you need it to, or if your dog moves around or anything like that. So what you want to do is you want to hang this up somewhere that it'll stay. So I've got a hook here that I'm going to hang it on. It works better when gravity can help it. So the higher up that you can hook it, the better and faster that your fluids are going to go in, and the less stress your dog or cat or whatever is going to be in while you're doing that. So with the line, it's got a couple of different lock mechanisms that you want to have unlocked when you're ready to use it. So there's this little plastic piece. Right now it's on lock. You can see the little slit there. If you move it to the open position, now it's open. The other lock, you can go ahead and lock it for now. The other lock that it has is this little sliding mechanism. So right now it's locked. If you slide it up, that's now unlocked. It can move freely around on the line. Slide it back down. It's like a little wheel. Then you'll lock it back. So the another important thing that you need to know about doing fluids, you need to have a clean needle. So this is the needle that I used last time I gave fluids, so I'm going to go ahead and change it out. If you have a pretty decent sized dog like I do, he's about 56 pounds, an 18 gauge needle will work. So that's your 18 gauge. So you're just going to untwist this part, take off the old needle, and you're going to twist on the new needle, just like that. Make sure that's nice and tight. Alright, come here, Max. Come here. Come here. So we're going to give fluids to Max today. There's a spot behind the neck, between the shoulder blades. There's a lot of loose skin there. If you can see all that, that's where you're going to put it. So that, basically, you're going to pull up what's called a tent and make that little tent, and you're going to stick the needle in that. So let me see if I can get him positioned a little better so you can see. Okay. So you're just going to feel right where the shoulder blades are. You can feel both of those shoulder blades poking out, and you should have a pretty good amount of loose skin there. So what you're going to do is you're going to uncap your needle. Don't use your mouth to take that needle off. I have a bad habit of doing that. And you're going to pull up that skin, and you're going to stick your finger right there, and you'll feel kind of where a tent, like if you can picture like a camping tent, you have the triangle and then you have the opening. You're poking with your finger, you're poking where that opening would be. So you're going to go ahead and stick the needle in there. Max is usually pretty well behaved for this. Okay, good boy. He doesn't like the poke, but he usually sits here pretty well. If you have a dog that's pretty squirmy, you might need an extra holder. So you've got that needle in place, you're going to hold it, and then you're going to unroll this. I already did that. So roll it up to the top, and I undid it, and you're going to undo this plastic part. And now you've got the fluids rolling. So you're going to look at your bag, and you're just going to watch and see how much is going down while you're holding that needle in place still. So with the bag that's up high, You're going to watch, and you're just going to watch that amount go down, and however much your vet says to give. So like if you started at the 1 here, right there, and he wanted you to give you 100 or 200 mils, if he wanted you to give you 100, he wanted you to give 100, you would go from the 1 to the 2, so that'd be 100. Those increments are all in 100 mils. So you're just going to hold that needle in place. You're a little far forward, buddy. Okay. So that needle is still in his back pretty good. You're going to start to feel like a little bolus of fluid underneath the skin, and that is very normal. That fluid will distribute over a few hours and hydrate. It's just right under the skin, so that the under the skin layer, the subcutaneous layer, absorbs that water over a few hours, and then they get hydrated. So however often your vet says to give them fluids, that's how often you would do this, and it would keep them hydrated that way. So basically, when you're done, I've got a good little bolus here. You're going to go ahead and lock before you pull out. So I'm going to push this down, and I'm going to lock the plastic part with one hand. It's good that I have a well-behaved dog. Alright, that's locked, and as you pull out, you're going to put your finger where that needle was so that none of the fluid comes out. I'm going to go ahead and pull out, and I'm going to keep my finger on where that needle was. Good boy, Max. Fancy Max is very well behaved and cooperative for this, which is nice. So you're just going to hold your finger there for a little while, make sure that that fluid doesn't come out of that little bolus, maybe 30 seconds to a minute. Hold that, and then, like I said, that pocket should stay there for a little bit, but it will distribute over time. It's pretty firm, kind of feels like a little tumor, but it is very normal. And then your dog should be rehydrated after that. If you have a dog that's not as good as Max, you can have somebody help hold and all of that. Because most dogs don't really like needles going in their backs. But you know, it is just subcutaneous. It's not anywhere deep. It's not in the muscle. It's not really a painful area. But if they're not used to it, it can be kind of squirmy for it, especially if they're younger. So that's about it. That's how you give fluids to your dog or cat if they are dehydrated and you want to get them rehydrated. So make sure you ask your vet for advice if you're uncomfortable with doing it first, and make sure you ask them how much you should be giving them according to their weight and how sick they are and whatnot.